Now for next up, we're trying to look at another type of sepsis, and this is what the sexually transmitted neonatal sepsis. Sexually transmitted neonatal sepsis. So of course, when you say something is sexually transmitted, the pathway is this: the baby got the disease condition from the mother. The mother got the disease condition as a result of sex. Okay, so now let's look at possible organisms that could actually spread through this pathway to the baby. Okay, so sexually transmitted infection in pregnant women can lead to what? Them spreading this disease condition to the baby. Maybe during birth there was trauma, through the placenta, do you understand? And all of that, or after birth, just during the mother care and all of that, So there a particular case that they usually cause early onset sepsis. Okay, so these infections are typically transmitted vertically, so they move from the mother to the baby. So for the sexually transmitted infection related neonatal sepsis, we have organisms like the herpes simplex virus. Okay, this one is usually direct contact with what? Genital lesions, and usually occurs during childbirth. So presentation, the baby is having all those skin lesions, encephalitis, disseminated sepsis-like illness. Then syphilis is transplacenta during birth or during pregnancy. Okay, so they move through the placenta. So that one, most of the times the baby is having a large spleen, the baby is having a large liver, there's rashes, there's anemia, there's bone abnormalities, So HIV is spread through the placenta, perinatal or via breastfeeding. So presentation, immunosuppression increases susceptibility to sepsis. Okay, so chlamydia trachomatis infections, that one, transmission is during vaginal delivery. Okay, so presentation, the baby is having inflamed conjunctiva, alright, pneumonia, and so on. Maternal screening and antibiotic treatment is like a way of trying to prevent. So necessarial gonorrhea, transmission is usually through birth canal. As the baby is navigating the birth canal, you are having all those wounds and all of that. So usually you have ophthalmia neonatorum coming up, septic arthritis, okay, disseminated infection. So why it happens? Okay, why it matters? Why is it important? So, it can be prevented through all those routine screening of the mother. If you screen the mother, you initiate treatment early, you prevent all these issues. Okay, then timely maternal treatment. Of course, if you initiate treatment early, okay, there's low risk, appropriate delivery planning, okay, and all of that. Okay, so this is what we have here for sexually transmitted neonatal sepsis.